Role of the social worker. The social work treatment plan has 7 categories of focus: adherence, coping mechanisms, level of independence, mental health, modality, and transplant, with transplant being the ultimate goal. The kidney transplant team wants to see that the patient is compliant with the treatment prescription, knows what medications they need to take, and are able to consistently adhere to the schedule on their own as some means to qualification. As aforementioned, not all ESRD patients are interested in transplant, and that is where goals become more individualized. There may be a patient that is struggling with depression, therefore, gaining longer term outpatient mental health services becomes the main focus. Or if a patient is non compliant with the treatment prescription and misses days, then concentrating on treatment adherence will improve their overall quality of life. David views himself as a figure that is able to empathize with the patients, validating their feelings, as the nurses and technicians that perform dialysis treatments are extremely busy and unable to give the patients that individual time they may need, and that seems to be the biggest component of his position. Another large element of the social work position is assisting patients with obtaining insurance, and David was able to provide a simple breakdown of coverage in layman's terms. He explained that upon starting dialysis treatment, a patient may present with no insurance or with commercial insurance that they can use for up to 33 months, at which time they have to convert to Medicare. Patients are able to keep the commercial coverage as the supplemental secondary insurance to cover the 20% that Medicare doesn't cover. Private insurance doesn't want to pay the lifelong costs of dialysis treatments, so this ESRD bubble of healthcare is the only universal healthcare in the U.S. economy. With commercial insurance, the clinic would negotiate a contract, but CMS will pay a set amount and the clinic has to accept it. David states it costs less for Medicare and Medicaid to pay for hemodialysis based on bundling the treatment, supplies, laboratory services, drugs provided with treatment, and capital costs related to operations. A piece of information that was new to me is that an ESRD diagnosis does not make a patient automatically eligible for Medicare. Although they are technically disabled, if they have not paid into the Medicare, they will have a 2-year waiting period before they will be accepted into the program. Medicaid, as traditionally set up, would pay 100% of treatments, medications, etc., for low income patients. The American Kidney Fund is available to pay a patient's COBRA for medication or a portion of the treatment payments until CMS coverage is initiated, and David assists with the coordination of obtaining coverage. Hardships related to coverage and assistance through social work. An example of an obstacle that dialysis patients frequently face is in the renewal of coverage. For instance, with CMS, an annual renewal application must be filled out. If the patient is in the hospital or rehab and doesn't receive their mail, the coverage could lapse. As a social worker, David would assist with the reinstatement. Another problem he sees that patients frequently encounter is presenting to the clinic with Medicare Part D prescription coverage that will not cover additional medications needed for ESRD maintenance, such as phosphorus binders. Therefore, the patient will end up paying a higher price for this important medication. David is able to assist patients in signing up for binder programs to offset the cost until the patient obtains the appropriate Medicare prescription coverage. Patients on dialysis are not able to go for long periods of time without receiving treatment, which can cause a problem in case of travel. Many of our Massachusetts patients travel to Florida to break away from the cold climate in the winters. But if Medicaid of Massachusetts is their insurer, they will not be covered in Florida. Therefore, they would have to pay out of pocket in order to be able to travel outside of the state. They can apply for Medicare to cover the treatments, but then the patient is confused about which coverage to use at what time. This can cause the patient dismay, and the social worker gears them in the right direction. Although David is unable to expedite the time that it takes to process the paperwork, being well versed in filling out the applications, with his assistance, the forms are usually correct and ready to be accepted upon first submission.